Hi, I'm Amy Olak, the CEO here at the Washington County Commission on Aging. Welcome back to Living In. Today I have a special guest with me, Shannon Murphy, a physical therapist. Hi, Shannon.
Hey, how are you?
Great. Shannon, tell us a little bit about yourself.
Well, I've been a physical therapist for almost longer than I haven't, but in private practice, I own an outpatient clinic in Boonesboro, so we see a wide variety of people, including older folks and people who are dealing with some of the issues we're going to talk about today.
Great. And so today I asked Shannon to join us. We're going to talk about how medications can increase your risk of falling. So Shannon, tell us a little bit about how individuals should be looking at the medications they're on and what risks come along with medications.
Yeah, so anytime you get a medication, you get a long list of things from the pharmacy, and some people just chuck it right in the trash or the recycling, and some people read it, and there's advantages to both. Knowing what side effects are possible is important, but not getting freaked out that they're all going to happen to you, I think, is also important, because you can kind of psych yourself out and think every little thing is a thing. But being aware that a lot of medications can cause common problems. So a lot of medications have the potential to make people dizzy, especially when you're starting it for the first time, or you're getting used to a new dose, or if you're on other medications. So being on the lookout for those types of things, because obviously if you're dizzy, it makes you a little more likely to kind of step the wrong way, get up a little funny, etc. Another common thing is, maybe not being dizzy all the time, but just dizzy when you go to get up and change position. So a lot of medications have a side effect where it'll lower your blood pressure temporarily, or it makes it a little harder for your blood pressure to catch up when you change position. So especially things like fluid pills, where it takes some of the pressure out of your body, because it's trying to do that if you have high blood pressure or you have congestive heart failure or some of these common things. But it just means you need to take a little bit more time when you do stuff.
Yeah, so when you're looking at your medications, really important that you speak to your physician or your pharmacist to get some direction on exactly what those side effects could be with your other medications and how they could impact you. Certainly all of those safety things that occur. So making sure you're removing all the throw rugs, making sure you have night lights if you have to get up in the middle of the night to go to the restroom, and making sure that you're taking your pills at the right times.
Right. Yeah, and so depending upon, the more things you're on and the more doctors you have involved, the more complicated it can get. And it can really take a lot of conversation to get to the right cocktail, so to speak. So, if you've got a cardiologist and a lung doctor, heart doctor, a lung doctor, your general doctor, and maybe an eye doctor or something like that, all kind of giving you stuff for their own specific thing that makes sense, but they're not maybe quite as aware of everything else that's going on. It's really important to have a good relationship with your general doctor, who hopefully does know you or has known you for a while. Or get with a doctor that specializes in older populations. So there is a field called gerontology, and working with a gerontologist, they will usually be very keyed into this idea. Or just even your local pharmacist, schedule an appointment to sit down with them and say, here's all my stuff. Do you see any issues? Am I taking these at the right time? Because we had talked about, if you're taking a fluid pill at night and then you're getting up and having to go to the bathroom, A, it's inconvenient. B, it's interrupting your sleep, which has a lot of negative consequences. And C, people are just more statistically likely to fall at night when it's dark and when you're half asleep. So there are a lot of little tricks to dial in on.
Absolutely. And so, Shannon, is there any other suggestions or advice that you would give us today for medications? I know you'll be back talking about some other great important topics as it relates to physical therapy and rehab, but is there anything from the medication perspective that you would recommend for our audience today?
Yeah, I think if you're not already using pill trays, I think pill trays and setting up your meds in advance is better than trying to take them out of, especially if you have a bunch of them, taking them out of a bunch of bottles. It's just easier to be consistent with the times you're taking them, making sure you're getting all the same ones at the same time. It's just, the more organized, the better. And really kind of working with somebody, if you are on a lot of medications and you do see a lot of doctors, working with somebody to find the least, the minimum amount of those that give you the best bang for your buck.
Absolutely. And sometimes we just have to start from ground zero, right?
Yeah.
We use a med to treat a side effect, and we keep adding on, and we end up with 14 pills,
Right.
when in reality, maybe 4 is sufficient.
Right.
But everyone's different, and I think that's an opportunity for you to reach out to your primary care physician. If you don't have one, you can certainly reach out to Meritus Medical Center, and they will see that we can get you in touch with a physician. You can call us here at the Commission on Aging and talk to someone in our Maryland Access Point at 301-790-0275, and we can put you in touch with Meritus if you have any questions about that. We want to thank Shannon for being with us today and for her wonderful advice and great directive. And please stay tuned to future episodes with Shannon. Look for her. She'll be out there in the near future with some great additional information to support you in being safe during these times. Thank you.